So with the end-of-life care, with the new ambitions document, which Professor B. Wee, as the National Clinical Director for End-of-Life Care, has been working to promote, one of the big issues, I think, in the south of England is that we have pockets of really good care for patients at the end of life. And obviously, people will be very familiar with some of the palliative care teams and hospices that we have across the region. But I think that one of our big issues is trying to make sure that all patients, as they approach the end of life, have access to that same high quality of care and that very personalised care, which focuses upon what they need and the needs of their families and carers as well. And for me, that's one of the things that this project seeks to address, is to offer that opportunity for really high quality end of life care for people beyond perhaps those traditional areas of cancer which seem to have been the focus for so long. So I think the PFCC programme, as we are trying to establish it across the south of England, is very much one which tries to build upon, I think, some of the themes that come out of the 5-year forward view, even of trying to look at patients and their families as individuals and try and focus upon what is important to them in terms of how we then plan care with and around patients and their families. So I think this programme and the aims of the Point of Care Foundation and this project in particular completely chime with our ambitions through the 5-year forward view. So I think there are obviously a number of documents flying around at the moment on end-of-life care, and that I think is quite proper in the sense that it's such an important area to focus on. And what I think I would ask teams to do to make sure that this links to the PFCC agenda is to look at the ambitions document itself, because that pulls together a lot of the published information. I think what I'd also ask people to do is to recognise that the PFCC approach is very much focused on what's important to the individual and to their families, and that very much is a central part of the ambitions document itself. So I think it fits perfectly, and I think the lens through which we would ask people to look is through the lens of the individual and their families. I think that in terms of keeping a focus on the project through what are very difficult times for staff and indeed the public in terms of changes to the health services and so on, I think one of the things that they can keep a focus on is this is all about individuals. It's all about what's important for individuals. It's all about what's important for individuals and the support that they and their carers get. And why that's important, I think, as a focus is because that then helps staff work together properly as teams, because they're working together with the patient at the centre of everything that they do. And I think through all the storms and everything else, that is a constant that I would ask people to stick to, no matter what aspect of care they're focusing on. So my hopes for this programme are very much to use the PFCC methodology in end-of-life care as an example that can be used and shared then. Obviously, we've got a very disparate group of settings for this work in the pilot phase, but what I'm hoping is that the success from that can spread in other parts of organisations to show what value there is on focusing what's important to an individual and their families and carers, and how much better the care that patients experience is through that approach. So that's what I'm hoping for. Advice for the teams taking part is talk to each other, both internally and use the opportunities that they have to meet with each other. It can be difficult to keep a focus, but I think for me, the thing that drives me on is the thought that for every single patient and their family that they're able to have that focus on what their needs are, there will be a patient and a family at the end of it whose experience of the end-of-life care will be better as a result. And that for me is a huge motivation.